Hi, today we'll look at virtual reality and how it can be used in the treatment of social anxiety disorder. Social anxiety disorder is a common mental health issue and it impacts a large number of people and happens due to the fear of being judged or embarrassed in public. Virtual reality, in conjunction with in vivo, which is the real life scenario, having a human interaction with the patients in public, are both used as part of the CBT sessions to improve SAD. The advantage that virtual reality has over in vivo is the elimination of the fear factor that the patient has always been exposed in public, and the repetitiveness of all these scenarios without the need to be outside the office with a therapist. So to look at that more in details, we picked up a paper by Bouchard et al., and that was published in 2017 in the British Journal of Psychiatry. Bouchard and his team, they were referred a sample of 59 patients, and my first observation around the nature of the sample, it did not tell us the breakdown of the sample, whether the number of males versus females and the social background, the educational level, because we all know that SAD is due to a fear factor here from being in public. And there is a difference between fear factor for females and males. Hence, the actual assessment should have been more particular about what sort of scenarios that were used for the sample and the breakdown of the actual sample. Now, the sample was broken down to three different groups. The first group, which was 17 patients, and they used the CBT sessions using virtual reality. The other 22 patients, they were using CBT using in vivo, which is the actual human stimuli. And the last one was called the waiting list, which did not receive any treatment at all. All these treatments for both CBT groups, whether using virtual reality or in vivo, they are based on operant conditioning. And the stimuli in the virtual reality group was using the head-mounted units, and in vivo they were using human stimuli to generate the conditioned response in both groups. Now, looking at the therapy, the actual therapy of both groups of CBT using virtual reality or in vivo. In vivo, the scenario was based on taking the patient out to a shop or a shopping center and getting them exposed in public by asking the staff of the shop embarrassing questions or be wearing something funny, and someone would be recording the patient's reactions or response. In virtual reality, the patient will be wearing a head-mounted unit connected to a motion tracker, and there were scenarios, simulated scenarios, and the patient will be watching that as if they are in a room with someone, and the conditioned response would be tracked as well. The outcome of the tests was based on a pre-assessment and post-assessment. The pre-assessment, there were all sort of diagnostic tools that were used in the pre-assessment, like DSM-5 and other phobia and fear scales. They were used the tests, the sessions, and the sessions were about 14 sessions, 30 minutes each. And then there was a follow-up, and there was a follow-up after 6 months, which is another observation I have on the paper, that the follow-up should have happened earlier than 6 months. In my opinion, it should have happened at 3 months down the track from the post-treatment, which enables the team who's done the actual tests to have a better indication between the 3 months period and then on the 6 months period. The outcome of these tests showed there is no significant difference between CBT using virtual reality and CBT using in vivo. However, there is a huge decrease in SAD between the group that used virtual reality as part of the CBT sessions and the waiting list group, which was not treated at all, which shows that the efficiency of virtual reality is there. However, the difference between that and in vivo was not huge. The only advantage, which it's not a small advantage, it's a big advantage, we have to say this, that the patients feeling more comfortable using virtual reality is a big advantage, and it's an encouraging sign for the patients to seek help if they can see that there's no real life exposure in public places, which is the biggest fear that causes SAD. So, in my opinion, the biggest advantage of virtual reality in CBT sessions over in vivo is that the patient will feel comfortable to approach and seek help. On the other side, again, comparing a treated group with virtual reality in CBT sessions with a group that never received any treatment, it makes sense. The efficiency is there. So some of the limitations were listed in the paper, that the results were not assessed by independent bodies, which is one of them. So thank you.